Team Healthcare Clinic is a wellness center. It employs a variety of different professionals, including chiropractors, physical therapists, and medical physician. We also do acupuncture. We feel like God created us to be self-healing, and what our role is to help the body to heal itself. So we are always looking for natural remedies or treatments that just tap into the body's ability to heal itself. And as such, then, we really prefer not to use medications whenever possible, because generally medications are used when the body is no longer thriving and has failed in some ways. And while they may be necessary, our preference is to try to find ways to make the body run better.
I believe really the thing that makes our clinic stand out is that we have a variety of different providers, each with a different specialty, something that they're good at. And the most important part for us is recognizing our strengths and weaknesses as providers and giving the patient what they need.
Integrated team concept benefits because what one doctor doesn't know or what one therapist doesn't know, another one does. So we have the ability to pick each other's brain and really to the benefit of our patients.
We have more tools in the toolbox, basically, to benefit them.
The chiropractic, the acupuncture, the nutritionist, and the physical therapist, that we are able to, we all have different training, so we're able to use our expertise, combine them together to meet all the needs that the patient has.
As a chiropractor, I have a real keen interest in several areas. One of them that I do in the clinic is allergy treatments, especially food and airborne related allergy treatments called NATE. And a very strong interest of mine now is treatments to help with imbalances in the brain for many conditions, but amongst them would be ADD, stroke, Parkinson's, autism, cerebral palsy.
I have a special interest and have done over 100 hours of postdoctorate training in something called vestibular disorders, which is imbalances, dizziness, if you will. And it's something that we see a lot of, actually, especially in our population as they age. Additionally, we have in our clinic something called vertebral axial decompression, also known as VAX-D. And we've had it for 10 years, and as a result, we've seen it's for really stubborn lower back disc conditions, conditions that many times would have headed to surgery. But we've gotten referrals from other chiropractors, medical doctors, physical therapists for our VAX-D. And as a result, we've seen some of the toughest lower backs around.
One of the services we provide in the clinic is being able to work with your diet and nutrition. A combination of things are involved in getting people to feel better. Working structure with chiropractic and PT is very necessary, but if we don't get your diet right, if we don't get you the right nutrients, your body's never going to respond like it's supposed to. So part of what I do in the clinic is work with the nutritional aspect of your health.
We are a family practice physical therapy department, which means we treat people from all ages, from the time they're born to throughout their whole life. And in that we treat all sorts of diagnoses, and we will deal with like stabilization, strengthening, stretches, range of motion, but also vestibular balance issues, pretty much the whole gamut.
We are able to give our clients many tools to help them to achieve their health and wellness goals.
I want every patient that comes through our door to feel like they experienced three different things: a level of competence. They feel like the doctors know what they're doing, and the therapist. Thoroughness as well. It's very important that they feel like we took the time and used our knowledge to benefit them. And the last thing is they need to feel cared for. Sometimes I go home at the end of the night and I'm exhausted, and I'll tell my wife I tried to hit a home run every time a patient came through that door. You try to hit a home run for them every time. They should feel that kind of caring.
My motivation for coming to work is that this is just fun. I love the ability to help people. I love meeting with people all day long. I can't imagine ever doing anything else.
We want our patients to experience compassion. We want them to feel that their concerns are heard and be assured that we'll do our best to help them achieve their treatment needs.
Sometimes I hear from people who have really tough problems. I've already been to the chiropractor, or I've already been to the physical therapist. And I want them to know that when they're here, they're going to get a broader approach than probably what they've had, just because we have so many different options available with different providers supplying their own specialty, and could be done even sometimes multiple providers on a visit in order that they're getting the best care with each provider.